guys, so it's Michaela Bensko with Veterans in Pain, and we're going to start doing these little mini videos explaining what certain procedures are and answering some questions they may come in. So very casual, and I'm reading things so you don't have to. So, bone marrow aspirate concentrate. What the heck is that? BMAC? Is it a Big Mac? Is it a burger? Is it a double-decker? It's none of the above. So bone marrow aspirate concentrate, which is just for short is called BMAC. So bone marrow aspirate concentrate. So properties that are extracted from bone marrow is essentially what that means. It's a component of your bone marrow that contains growth factors and anti-inflammatory proteins, which have been shown to promote bone and soft tissue healing, as well as reduce symptoms of pain related to injuries, tendonitis, and arthritis. We've seen it oftentimes with our veterans that will be used most predominantly when addressing spine. So, how is it done? Oh, this is the fun part. Stem cells can be found in many tissues throughout your body, but one of the richest sources can be found in bone marrow. So fortunately, bone marrow can be harvested from several bones within your body and is relatively easy to access. So your bone marrow will be aspirated through a small needle puncture in your posterior iliac crest or your pelvic bone and placed in a special processing unit which will concentrate your body's stem cells, platelets, and growth factors. And the concentrate will be collected into a sterile syringe and injected into the targeted body area being treated. Really important, especially when you're addressing spine, make sure your physician's using fluoroscopy. It's a live video x-ray that is performed during the period of time when you're having your procedure. So the physician can see exactly where the needle's going into the spinal area. And with joint specific procedures, high resolution ultrasound guidance while they're doing the injection. So the imaging is so important even during the procedure. So why is BMAC recommended? BMAC may be recommended typically for patients who have failed other conservative therapies, including physical therapy, medications, rest, and other injections. It's also a good option for those that are not candidates for surgery or prefer to avoid elective surgery. Conditions that may be treated include osteoarthritis of the shoulder, elbow, wrist, hand, hip, knee, ankle, and foot, rotator cuff tears, ligament tears, including tears of the UCL in the elbow of throwing athletes, hip labral tears, articular cartilage injuries, advanced tendon injuries, and high-grade tendon injuries of the shoulder, elbow, hip, knee, ankle, and foot, and muscle strains or tears. But this is definitely a procedure that we see used in spine very often. What can you expect? So patients may experience soreness at the collection site and treatment site for a few days following the procedure. So normally they'll put you out for this procedure, but they will use local anesthesia, and you're gonna feel some tugging and pulling, but it shouldn't be painful. But afterwards it could be tender. So you can definitely get some inflammation after the procedure. And 90% of pain is inflammation, so there you go. Most patients will begin to see improvement approximately 1 to 2 months after treatment has been completed. You have to be really patient with regenerative procedures in general, these interventional solutions, because they take the regenerative cycle. That's my dog. Those are my dog's toenails on the floor. Okay, Stanley. Yes, Stanley as in Marvel. Stanley, you're amazing. Stop breathing on me, but I love you so much. I do. Okay, so I don't know. Where were we? Oh, recovery. So regenerative cycle itself can take 9 to 24 months for a cycle to complete itself. But for you to get to your new baseline, per se, of where your new, hopefully improved baseline or pain levels will be, you'll usually see that around 6 months or 9 months. So you have to have patience, and remember, after you have a procedure done, whether it's BMAC or PRP or any of these procedures, you could be in more pain afterwards than you ever were before. So when the cycle is working, it's going to create additional inflammation. This is good inflammation, okay? So don't worry about that as long as it doesn't have a fever attached to it or extensive redness and swelling kind of thing. So, and what are the risks? So the risks of this type of therapy are extremely low, but as with any procedure, there are possible risks and complications. Although very unlikely, any injection can potentially cause bleeding, increased pain, infection, or nerve damage because your own cells are being utilized. There is no risk of tissue rejection of the cells, so that's good. All therapies are performed under musculoskeletal ultrasound guidance. Yes, thank you very much. To perform precision injections into the injured tissue. All right, what is the cost? Dun, dun, dun. So one joint alone, if you're lucky, then it's around $4,000 if you're lucky. And normally for spine, it can be started around 10,000. And joints can be anywhere from 4,000 to 8,000 a joint, and usually not covered by insurance. However, that is starting to change. Okay, so PRP procedures are now starting to be covered by insurance. So be sure to ask your insurance to see whether or not it is potentially covered. Okay, and let's see. That's about it, all right, for BMAC today. That was fun. And so we're going to be doing these little videos, these little vignettes of 411s for you guys. And I guess this is until next time. So have a great night, and we will see you very soon. This is Michaela Bensko, veteransinpain.org, VIP Vet Talk, signing off.